So, good afternoon, everybody, and welcome. Thanks for joining us for what we think will be an important and honest conversation. This session is on when early success doesn't stand the test of time, rethinking leadership and sustainable change in times of crisis. I'm Kieran Walsh, Clinical Director at BMJ. This webinar is part of a new series which is part of our wider offering to the International Forum on Quality and Safety in Healthcare. We're hoping to see many of you at the forum in Oslo on the 9th to 11th of March. So back to today's webinar. In healthcare, we're used to measuring success through outputs, ratings, awards, accreditation. But what happens when a model that works in stable conditions begins to fracture under pressure? When a system designed for shared leadership suddenly defaults to command and control? In this session, we'll explore a real-world example, an award-winning, outstanding practice built on Holocracy, a flat, self-organising model of governance introduced in 2016. It delivered results for patients and for healthcare professionals. It worked until COVID-19 tested it. And so today we'll examine why well-designed systems can falter in crisis, how apparent success can mask fragility, and how leadership models can be made resilient enough to hold when it truly matters. So you leave with practical insight into qualitative metrics that capture trust and social capital, know about the strengths and limits of flat leadership models, understand systemic fragility, and learn about sustainable improvement and shared leadership. So this session is for all who want systems that will endure. I'm delighted to introduce our two speakers. Virginia Patania is CEO of the Jubilee Street practice, an outstanding rated practice, and also Commissioner with North East London Integrated Care Board. Joining her is Safa Mughal, an operational director with more than 15 years' experience across commissioning, strategic development, and system leadership. As we go, please do add questions to the Q&A, which should be at the bottom of your screen. So Virginia and Safa, a warm welcome to this BMJ webinar. Over to you both. Thank you.
Hi, everyone. My name is Virginia. I'm presenting today with my colleague, Safa. And what we'll be sharing today is a story of, I guess, a difficult understanding of leadership, a big slice of humble pie for my ego personally, and hopefully a journey that will help you make decisions and avoid some significant pitfalls that we stumble.
We should give Virginia a few minutes. Safa, sorry, if you wouldn't mind kind of taking over from your section, please.
That's absolutely fine. So I think what Virginia was starting to introduce was that we are a practice made up of around 16.5 to 17,000 patients. We are in inner East London practice, working in high deprivation areas, IMD1, and we are an award-winning primary care organisation. And our organisation is built around a leadership model called Circles, and they're self-organising. We've received CQC Outstanding regulatory ratings for them and national recognition through many awards that we'll talk through the pack. Our staff have high engagement. We've invested heavily in staff wellbeing initiatives, and all of that was great until crisis hit and our model cracked under pressure. So we'll take you through our journey in the next 30 minutes or what's left of the session, to tell you a really brutally honest story of what worked, what failed, and what we redesigned. I'm hoping that Virginia will take back her slides in a second, but I can continue if that's okay with everybody. Yep, if we go next slide, please. So introducing circles, as I mentioned, circles, it's a leadership methodology, and we would define that as small purpose-led teams that run the organization. Next slide, please. In terms of the model, it really takes distribution of leadership, a shared responsibility, which is very different to the more hierarchical models of leadership that we are used to in healthcare. Apologies, I'm getting a call from Virginia, so it might be her trying to rejoin. And in terms of the model, we're kind of really centered around three main points here. So we needed a model that had a really strong purpose. So it was the work organized around the way that the practice exists. So we recognized ourselves as not just a healthcare provider, but a healthcare provider that it has a really clear function. And also we wanted a model that was self-managing, where the teams decide, act, and own the outcomes across each work stream that they were responsible for. And finally, wholeness. So we wanted people to bring their full selves to work, as a GP, as a practice nurse, as whatever role that somebody might be employed in the practice. That doesn't necessarily speak to their natural strengths, talents, and areas of interest, and also their ambition. And so this model was really designed to grow our people as well as their whole selves. Next slide, please. In terms of the model, as I said, traditionally we are familiar with top-down models where the manager decides. There's the system's designed around a level of control or different varying functionalities of control, fixed roles, and highly bureaucratic. And when we introduced circles, it's a very bottoms-up approach where the team decides the work stream and how the work is delivered. There is a very strong element of trust. Roles are fluid, so as a GP, you may also be dipping into social media, infection control, and various clinical areas of responsibility as well. And it's fun. That was, I think, Virginia would be here, the key area that we wanted to emphasize on. We really wanted people to enjoy what they're doing and bring their whole selves to work. Next slide, please. So I mentioned a couple of these points, but the key points here is that we wanted a system that distributed autonomy with a central governance. So we still had a line management and a senior management team and a board, but was able to be adaptive, responsive, and innovation driven rather than rigid or hierarchical as we're used to in traditional healthcare structures. That is referenced in more detail. I can provide the link in the chat, where we have a full slide pack on our blueprint for staff leadership and how we've designed and modelled. It's very well researched and based on a lot of well-known literature as well. But these really are self-organising, value-led model with a clear accountability structure.
Safa, if you want to pass over to me,
Yeah.
I'm going to pretend Kamal. That's actually Virginia. Okay, I'm under someone else's intro, so I'm not sure how much you will have heard from Safa, but essentially, if I'm going to start my story in a slightly more personal way, we were a practice that had grandiose and excessive ideas of what it would feel like if everybody was a leader. So originally, in my view, I had this understanding that one day General practice could be like, for anybody that is UK based, something like a John Lewis model. Everybody holds shares, everybody has equal leadership. And the idea that the more you share leadership, the more people with autonomy will thrive, deliver, and actually give you more than if they had job descriptions and management structures and contracts that guided their work. So we thought a long time about what would this model look like, where you have people that essentially self-organize autonomously around things that they love and are deeply driven by values and purpose. We employed an intern that looked at all sorts of shared leadership models across the world, and we went with something that is called Holocracy. And Holocracy became circles and spheres. Holocracy is a model by which you essentially create small teams, multidisciplinary teams. So you can't have a team that's all nurses or a team that's all doctors or a team that's all administrators, but multidisciplinary teams that organize around every single task that your organization provides. So in the case of general practice, it would be chronic disease management, one circle for every chronic disease. It would be administration, HR, payroll, premises, IT. It would be governance, it would be patient engagement. And these small teams would essentially have absolute autonomy in driving the pieces of work that that team was meant to achieve. So to bring this to life for you, if I was part of a diabetes circle along with my 5 or 6 colleagues, my job would have been, by the end of the year, to deliver all the diabetes outcomes, including my average HbA1c, my numbers of retinopathy screenings, etc. That contract or that team was meant to deliver for us to achieve our payment standards. Next slide. So I'm going to tell you the 3 principles. I'm sure Safa spoke to them, but I think Safa joined a year and a half ago, and I think it's different on your skin 12 years ago than it was on Safa's skin when she joined. So the 3 purposes that were guiding us. The first was that purpose was not static, but was evolutionary. So your purpose constantly had to change, and it had to adapt to the values and realities that you were living at the moment. We deeply, deeply believed in the principle of wholeness, which I think is probably the one that I stick to most solidly, even now in this new version of our life. But it's that nobody has boundaries between work and your home environment. So we are not interested in you from, say, 8 till 4. You don't have to leave your home life outside. If you are getting a divorce, if your child is sick, if you are sick, if you've had a great day, if you're getting married, we want to know all of it. And not because we're interested in your business, but because to know someone that is seen fully when they enter work means to receive that person in a way that means that they can thrive in their day's task. If we didn't have this, people that were having a hard day, we'd deem them underproductive. People that were having a great day, we'd deem them manic. We don't want to do that. We actually want to be part of something that doesn't make you feel like you dread coming into work and you're finally yourself when you leave, or vice versa. So the principle of wholeness was really keen. But the third principle was self-management. So there's a lot of literature and evidence around kind of the impact of enabling mastery and autonomy and allowing people to thrive. However, guess what? This all sounds great when you are still yielding power. Like, it's much easier to pay lip service to all this and say that we really, really want shared leadership structures than it is to actually give away the power we hold. So these wonderful people that you see in this picture, and Kieran knows the man on the left, that's my partner Jens Rubak, and the others are partners that were present at the time of this shift. These gorgeous people were my partners. I want to tell you that when I came up to them and said, I think we have this great thing that we should release all of our authority, they all said, yes, absolutely. We should enable everybody and everybody should be a master of their own destiny. And then I said, but that means that we literally have to stop making decisions for everybody. We cannot bring things back to the partnership every time somebody wants or needs something. And that was a struggle. It was a journey. We walked it slowly, but it became, and part of how we did this was that we, every 6 months, we have a psychodynamic session led by a facilitator. That means that we all get together in a room to understand our relationships, our relationship with power, the roles we are assigning each other, as opposed to the things we're doing well, the things we're not doing well. What are we actually doing to make people behave in a certain way? And because we had that as a foundation and we had that for decades, these conversations, although difficult, became possible. Next slide. So I thought, let's just not say this in a room. Let's just jot this down. So one day in 2026, I can make a great presentation on this, even though Zoom doesn't work. So we actually had people sign on a sheet of paper. And this was an executive commitment to change. Meant once we sign this accountable as the 6 partners to ensure that every time we feel we want to hold onto that power because we don't quite trust our staff, we can hold this up and say, no, we committed to not doing exactly what we said we're doing. Next slide. The slide you're about to see, I'll speak to it as Marina shares it. The reason it's up is to show you that even after having undergone this process, we still remained a healthy and functional partnership. But not everybody was on board in the same way. Were we all looking for 100% buy-in? I think we'd still be stuck with job descriptions because we didn't wait for 100% buy-in. And I was going to show you, if I could have the next slide, the picture of the one person who still wasn't fully bought into this. But we went ahead with this work regardless. I'm now 2 slides ahead, so I'm just going to check, Marina, if you want me to keep talking or if there's an issue with the slides. I'll just keep talking. I will keep talking. When Marina, there we go. Okay, fine. Let's go straight here. So we drafted a constitution. This constitution was essentially representing the ways that we thought about our work, our values, and our principles, and the way that we would distribute this work. And it basically meant that every circle had its own charter, where a charter was a description of the work that they were meant to accomplish. This charter and the way that the work was shared meant that teams held each other accountable. They met regularly. They knew what they were meant to deliver together, and they knew what they would do in times of conflict so that it all didn't go back to the partners as soon as things stopped working. Next slide. So what we wanted to do more than anything, and this is, I think, what we have achieved, was create an ambience of real psychological safety where people felt that they mattered, people felt trusted to make decisions. But most of all, I guess my test of whether this worked or not was going to be, can we get rid of every single job description in the practice? Can you do away with person specs and job descriptions altogether? What would happen if you did that? And what would leadership and accountability look like? Next slide. So again, back to the principles. We were guided by purpose, evolutionary purpose, not a static purpose, real transparency. So we came up with a list of, I guess, ground rules around our behaviors. And I'll tell you my 2 top favorites. I was wondering whether we should put a slide sharing the rules, but they are in every single room that we sit in, including the room I'm in right now. And my 2 favorites are: don't oppose if you can't propose. So everyone's idea is valid and gets a spin unless you can't say no, unless you have a better one or a different one, and the data will decide. And the second rule was no corridor conversations. So we wanted a culture where you don't sit in a meeting, have a difficult conversation. You will have all been in this place. And then you get up, leave the room, and somebody approaches you. Oh, Virginia, what Jens actually said. No, none of that. Like, if you can't say it in the room, you don't say it at all. But we don't do a business outside and a business inside. Genuine psychological safety in a real sense of letting evidence speak and testing things that feel uncomfortable. Next slide. This was our circles wall. I share this slide because I think it helps put things into practice. So we had one learning event with all staff where everybody was given a marker, and they would all go onto this wall, which has erasable little plates. Every plate is a circle, and they would write their name on exactly the circle they wanted to join. The pillars on the side are the common work that everybody does, but you could pick 6 to 7 circles. You'd then stay in those circles, ideally for a minimum of 6 months. You can't swap until 6 months have gone by. But after 2 years, if someone wants to swap with you, you can do that. Next slide. This was what I've just explained, what is in our charters. So every single circle has a little document assigned to it that says its sphere of influence, what it does work on, what it doesn't, how much money it has to manage, does it have a budget that it works within, and how do you resolve disagreements. I mean, this is radical. I cannot tell you some of the ideas that we had within these. I'm going to give you the most radical one. It didn't last, and I think it didn't last because people forgot about it rather than because it failed. But at one point, the HR circle decided to do away with any fixed annual leave. It decided that it would test a model whereby anybody could take as much annual leave as they wanted. 2 people did that. We didn't fall over. These people were happy. They're still in the practice, but it gives you an idea of like what is possible when you let people exercise blue sky thinking, but where the consequences are on their skin. Next slide. We had fantastic results from a staff survey perspective. The biggest, obviously, the greatest areas of satisfaction were around self-management and the living of the evolutionary purpose. But people felt that transparency was perhaps an issue. And I wonder if this is because so much of this was kind of designed still from a leadership level, and it didn't fully feel, I guess, totally owned in terms of the detail of how this was going to work. But still, broadly speaking, there was increase in satisfaction across 6 of our 7 staff satisfaction domains. Next slide. We won a bazillion awards for this, and I mean a lot of awards. These were staff-driven awards. They wrote the pitches. They went to do the demonstrations for us. They went to the black tie events and got the awards for us. The people you see in this picture are 2 single mothers who were both receptionists at the practice, who have both now started their own company, a company called Thinking Space. Come and see them in Oslo. But these were literally 2 receptionists that created a pitch, won an award. They not only won us the award for the night, which was something around the Best Leadership Award, they won us Best Employee of the Country Award by themselves. I was at home doing something else. When this evening happened, I thought, wow, we have nailed it. We really understand everything. This is what everyone must do. Next slide. We even sold it to CQC. We explained that although a CQC, for anybody that is not from Britain, CQC is a care quality commission where you must achieve a number of guidelines in order to remain open and continue to practice. One of the things you must do is have job descriptions. We had done away with all job descriptions in favors of circles and charters. Somehow we sold it to them. They thought we were outstanding and well led. So they gave us kind of props on having breached one of their main regulations and gave us their first outstanding in 2016. Next slide. It's about to get ugly. Don't worry. Dun, dun, dun. This is where it all fell apart. This is why no one else does Holocracy. And we learned through a little something called COVID. Now, I had a stress test I wanted to do with everyone. I'm going to skip it because I've interrupted this session enough through tech and admin issues. But what we learned during COVID is, you may not believe this, but actually when there's an absolute crisis, when people have relatives that are dying, when they're working from home, when they're being deemed heroes because they're seeing people with a flu that's never been seen before, they don't want to self-determine. They don't want to be autonomous. They don't want to be creative. They don't want to thrive with no leadership. They actually need instruction, hierarchy, and speed, and they want it now. So this did not travel with COVID, one single jot. Performance dipped. We had a real culture crisis. We had a huge surge in people leaving the practice, massive exodus, which I think was to some extent true around the world. People started moving to the country. People had crises where they no longer wanted to stay in their vocational professions. But we experienced it, I think, in a particularly acute way because we were so cocky to think that our culture was so spectacular, so warm, so innovative. The fall was steep. If some people fell from midway, we fell from up high, and it hurt. It hurt a lot. Next slide. And so at that point, there was a real and rapid reconvening. There are a few things that we did, I would say not rapidly, but we did well. We gave up on circles almost immediately. We gave up on our partnership. We thought that the idea of the partnership didn't match the reasons that we had entered the circle sphere. They didn't match our ideas around staff leadership and autonomy. But we tried to think about how can we have a more balanced and equitable model of leadership that encompasses both traditional hierarchies, but keeps the principles that had led us to test circles in the first place. And if you're doing the maths, these circles worked, and they worked quite well for about 6 or 7 years. So it was a lot of thinking that we had to do to move to a new system. Next slide. And we use something, if you're interested in this, called the healthy organizational model. You can look it up. There's a QR code on the side. Next slide. It's essentially a model that explains the relationship between authority and anxiety. And I think that that was the missing puzzle piece that I had not clocked. It was the role of anxiety within organizations, and why does no leadership essentially create real issues where you have no boundaries around anxiety. So we went through a piece of work where we understood that actually having a hierarchy allows staff that are executives, so people that take direction, to transfer anxiety upwards, giving it to management, who translates it into information to make decisions in a consultative, humble inquiry mode. But there needs to be a flow of anxiety going upwards and delegated authority going down. Otherwise, you cannot work unless your conditions are basically anything less than idyllic, which during COVID, they were not. Next slide. And our vision evolved. And this is where SAFA comes in, because while we understood what we needed to do, we had a sense of what we needed to do, we were not good at doing it. Staff told us that we were not good at holding people to account. We were bad at holding difficult conversations. And I was a massive blocker in terms of designing a structure that looked anything but flowery, innovative, and full of fun. Enter SAFA, who I had known in a previous lifetime and had worked for me in a previous role. And we knew that we needed something new, that the skill did not exist in-house. And this is where SAFA came in. So SAFA, take it over.
Thank you. And so when I came in to the practice and we realized that the improvement wasn't traveling consistently across the organization, we understood that the issue wasn't commitment, it was actually architecture. We already had strong circles. What we didn't have was system coherence. And so circles in our old reality created energy and ownership, but as the complexity grew, regulation, workforce strain, community partnerships, COVID, we needed something more. Not hierarchy, not central control. We needed a structure that could align strategy, protect the distributed authority that we had in mind, reduce the fragility of the system, but withstand the pressure as well. And this is where spheres became that governance layer. So in our old reality, we would have decisions that were quickly escalated, but to nobody, because we had a distributed model, a fear of getting things wrong, hidden corridor conversations, exactly the opposite of what Virginia described our principles to be. That's not my job culture and leader dependency. And what we actually did was when we introduced spheres, a 4-dimensional model, we clarified purpose at every level, defined roles, not just the job titles, and we distributed decision rights rather than leadership rights. We made tensions visible, and by having those issues spoken about openly, we built psychological safety deliberately. We expected feedback, and by doing that, we challenged the silence. Next slide, please. And the 4-dimensional model of spheres, if you can imagine that in your head, I've explained this a number of times to Virginia. I'm still going there, but think astronomy. So what are spheres exactly? Spheres group the related circles that you saw earlier, the slide with the colourful circles, under a shared strategic intent. So where we had 77 circles before, we slimmed that down to 10 strategically themed spheres that each had oversight, not just operational interference. They clarified pathways in terms of escalation. There was a clear leader in each one, and we make cross-team tensions really visible. We also protect the role-based authority by doing that, and we make sure that improvement connects to purpose. And practically, that meant refreshing every single circle charter and defining measurable outputs. In our case, that was making sure that every charter aligned with the CQC regulations or whatever the regulation or compliance or legislation points were for that area of work. And we clarified the decision rights in that sphere. Governance suddenly became visible and portable. And why that's important is because we would we then reduce our system fragility, and we enable scale without losing the safety. Suddenly, everybody is inspection ready, as we've just seen with our CQC inspection in December, and we move from personality-led and people-led teams to a structure-led leadership model, which can be replicated. Next slide, please. And so this is what we created. These are our 10 spheres. And so what we learned was that improvement doesn't scale on enthusiasm. It scales on clarity. And the psychological safety that we talk about improves when roles are clear. The accountability actually strengthened when authority is explicitly known, and culture stabilizes when structure is coherent. So spheres didn't necessarily add control, they just reduced the dependency. Next slide, please. Back to you.
And I'll take it back. I'm going to be really fast at the end because I'm so interested in understanding what people would like to know more about. But this is our new organogram. We have essentially gone to a place where we now have a senior management team. The senior management team is wider than the partnership. There are 9 members, of which only 4 are doctors. 1 is a nurse, and the rest are various leaders across within the practice. And every senior management team looks after a certain number of people who look after a certain number of people, with these constant communication loops that are now firmly built into our weekly and monthly diaries, where we are able to check in both at micro level, meso level, and macro level with anxiety, performance, and development. Next slide. Our staff survey results spoke the language that we hoped that it would. We have finally achieved, and this is the first time in 20 years of me being at Jubilee Street, a place where people have expressed that they do feel clearer about line management roles and responsibilities. We went from 44%, which was the team's response under circles, to 84% in 2025. Next slide. An overall increase of about 8% in overall satisfaction. We have just today been told that we have won another CQC Outstanding, which, again, if you're from the UK, it is very rare that you will get 2 of these in a row. And I think the fact that we were able to eat humble pie around how bullshit we were about this lack of leadership certainly helped us in thinking about this second accolade. Next slide. And this is my favorite slide. If you're going to take anything from today, please take these 5 things. Culture does follow structure, and I had not really appreciated how deeply structure can hold the principles that I thought could only be espoused in total freedom. We are still using the same principles as values, just in a clearer structure. Distributed authority means that actually people are really able to make decisions and transmit anxiety, because I sometimes wonder if our shared leadership model was more choosing not to manage, like devolving everything is now down with staff, so we don't need to bother anymore. And I feel that now with much more engagement, we are obtaining a better sense of people's autonomy and ability to thrive. I'm going to go straight to number 4, because I feel it's true that the well-led excellence comes from architecture and not charisma, but I do still think about this point that charisma helps. Like if you have a leader that does feel like they hold the vision behind this, they have a belief and they have an energy, I feel like you need a bit of both, but just leadership on its own does not translate to something that is sustainable, which does require governance. And we feel that that governance now puts us in a very different position in times of crisis, in times of change, and puts us on a much more stable footing in terms of patient safety and kind of reduction of variation in the outputs and the deliverables of the practice. I'm going to stop here because we've eaten 6 minutes into our question time. And I really apologize for the ups and downs of logging in, but I also feel like this was a wonderful demonstration of how, failure can lead to success and how you manage it. So, hey, we made it and we got to the end.
Fantastic. Thank you very much, Virginia and Safa. Let's go straight to the Q&A. Sorry, going there now. So the first question, thanks to everybody who added questions. Please do add more questions. I have a question regarding holocracy. Zappos implemented holocracy, but it failed. How do you propose it will succeed in healthcare setups? I think you
I
kind
don't
of answered
propose.
that one in the presentation, so let's move that on.
And interestingly, we had stolen it from Zappos. So well spotted,
Okay.
Musab, because we had literally taken the Zappos model hook, line, and sinker, and it didn't work for us.
Great, good. Next question from Abhishek. How to accomplish this model in developed or underdeveloped societies or organizations where individuals are mainly interested in gaining their own ends?
Oof. The question I wasn't expecting today. And I'm going to give you a very personal answer. And I need to be careful about how I step in the realms of politically correct, where we talk about underdeveloped societies, because I don't know if these necessarily exist. But I will tell you that I'm Sicilian. And I come from a place where individuals are mainly interested in gaining their own ends, because that is how we are raised and brought up. And it's a very defensive culture. You know that if you don't take the emergency lane in the highway, 30 smarter people than you will. So everybody is constantly thinking about, are you the smart one? Are you the dumb one? So I understand the question. I have lived in that environment and I've practiced healthcare in that environment. And I'm going to say two things. The first is that I do think it takes a degree of cultural maturity to test open leadership and dynamic leadership systems. It's why I was referencing the fact that this was built on 20 years of us doing essentially therapy at least twice a year, often overnight, to understand and trust each other as partners and as leaders. So I would say, don't try it everywhere, especially don't try it if you think that you as an individual are going to make it succeed, because I think that that might be a problem right there. But the second is, I also feel that people are interested in gaining their own ends in an environment where there is a perceived risk. So I do also think that there is a journey that can be walked where people can come into work, feel safe, feel seen, and feel full, and that that's a human trait. It's not even a culturally defined trait. It's a human trait. And if you can start to put that into action, these principles become much easier to plant and flower.
Thanks, Virginia. Next question from Laura Hudson. I have a new team that I need to do this with. Now psychological safety is improving. Where do I start?
Where do you start, Laura? I think you start by saying that you want to start. I really do. I think you open it and you say, this is a new team. I want to do everything in my power to ensure that we create an opening that is safe, that is based on truth, that is open to principles of wholeness and people coming into the work with their whole selves. And you work through a design system together. I do think it would be interesting to read up both on Holocracy and the QR link that we provided around the healthy organizational model, because it might give you some ideas around designing accountability structures and also designing frameworks that limit the burden or the impact of traditional leadership while still providing safe and accountable structures for information to flow.
Thanks, Virginia.
Structured.
Right, good. Next question. Where is the community members beneficiaries in the system? And Virginia, Safa, please do decide amongst yourself who wants to take each question. Virginia, do you want to take this?
Can you repeat that again, Kieran? Sorry.
Where is the community members / beneficiaries in the system?
So I guess what you mean by that is, where does co-production sit and where do patients sit within the design and development of this? And I will be really honest with you and tell you that they didn't. This was very much about how do we empower staff, specifically staff and employees, to create a workforce where people want to stay. However, this isn't to say that members and beneficiaries don't sit in the system, because I would say that we have a whole, everything else in the practice is about the members and beneficiaries, including our quality improvement models and our co-production models. We have a well-being hub that is patient-led, and that is where kind of we engage the patients.
Super, thanks, Virginia. And I think you've answered Hilary Garrett's question about patient input. Another question, how do you create the reflexivity of the leaders and those around them so that they are able to shift mindsets / behaviors?
This is a brilliant question. Brilliant question. You create it, I think, in our experience, by specifically addressing constantly and specifically addressing the need for thinking spaces where there are no agendas, No whiteboards, no markers, nothing to do but think, reflect, and feel in a circle. No desks in the middle, round spaces where people sit and use the space to think. And you do that routinely. You do it when you don't think you need it. You do it when you do think you need it. You do it because it's good practice.
Thanks, Virginia. Super short answers from here, please. Thank you. Can circles be applied to trusts and hospital-based environment/acute settings?
Definitely yes, but more at ward level.
Discuss how solid systems contribute to organizational resilience during global crises, such as COVID-19.
Solid systems contribute to resilience in when you have solid clinical structures, your doctors don't leave and feel safe to come into work. This is why you need these solid systems, because in times of crisis, they're the ones that will keep standing.
A good question. How do you go about hiring if job descriptions are not strict? How do you performance monitor?
Beautiful question. We ask random questions. We say that we hire for talent and train for skills. We ask you, were you born to be a doctor or did you become a doctor? If you can't get this question right, I'm really not interested in having lunch. And we do that all the time. Even if we recruit a receptionist, we'll say, what are you passionate about? Why are you moving from Marks and Spencer's? What excites you about being here? Come with a spark. Please come with a spark. We've got the oxygen.
Has this model changed the way you deal with conflict?
Immensely, in that I used to avoid it. And so I made circles hoping that I could ignore it. And none of that has helped. And so now we deal with conflict. We actually manage conflict, but we manage when it's small. We don't wait for it to become large.
Does patient satisfaction with practice reflect improvements, changes in the structure?
Our patient satisfaction is an exact reflection of our staff satisfaction. And when I say exact, 2020 yielded us results that were in the top 1% of the country. We had 2 responses on the GP patient survey that were 100%. We could only go down. When staff went down, our results plummeted. Since we have now implemented these new leadership structures, we are once again in the top 5 to 10% of the country. As good as staff is, patients are.
Fantastic. Virginia, shorter answers, please, and try and get through them all. How does this support long-term sustainability in the healthcare system?
Stable workforce, doctors don't leave, administrators stay, nurses are happy.
In a medical college where everyone is responsible for student welfare, but no action happens, how would you apply distributed authority principles?
I would be very thoughtful to understand accountability. If everyone is responsible, what does that mean for everyone and how are they held accountable? Rather than responsible, accountable.
How do you distinguish between struggling and actual failure?
Failure would be, we never failed, we struggled. Struggling is when you can still change and you can still improve. Failure would be if you've hit the end of the route. That hopefully rarely happens.
Last question, we got to stop on this. Do you have a book on this, Virginia?
Oh, I don't. I'm sorry. I have a 5-pack that you'll be getting in the mail.
Okay. So thank you very much, Virginia and Safa. And as you said, a good example of overcoming adversity. We got through and delivered. You got through it and delivered it. So thank you very much. We're recording this. We'll share the recording after the event. If people need certificates of attendance, we'll be in touch after the event as well. Thanks very much.
And see you in Oslo. Come and find us in Oslo.
Yeah, absolutely. And thanks very much to everybody who took part, who joined, who asked questions, who added to the Q&A, who added to the chat. That was fantastic. Exactly what we want. Thanks very much to our speakers as well. And as Virginia says, we hope to see you in Oslo, March 9th to the 11th. See you then. Thank you very much indeed.
Thank you. Bye, everyone.
Bye now.
They met regularly.